Right, there definitely is a surge in this younger population. We call them Gen Z or the Zoomers, right? So there are 14 to 29-year-olds right now, and they're digital natives. So they actually were born with devices, and they're using their devices constantly. They're using them for school, they're using them for work, they're using them for entertainment. That's how they communicate with their friends. They're always text messaging, instead of like we're used to maybe a phone call. So they're always on their digital devices. They never take a break, and that's a big problem. Some other things we're seeing is things like cosmetics, for example, lash extensions. So 50% of consumers actually of the lash industry, so think like lash extensions or eyelash perms, lash tints, things like that, are actually Gen Z. Yeah, 50%. So big numbers. Other things that we notice and we did talk about in our lecture are things like diet. So, eating ultra processed food, eating fast food. So that's definitely affecting their dry eyes. And then also sleep, not getting good quality sleep. So this is also our kind of age range that's getting refractive surgery, right? So it's our 20 to 40-year-olds that are usually getting refractive surgery. So that can cause some dryness. And then skin conditions, things like rosacea, Demodex blepharitis. Yeah, so it's so interesting because when the patients come in, they don't even know what dry eye disease is. They've never even heard of dry eye disease before. So they're not equating their symptoms to an actual disease. Like you said, they normalize their symptoms and they just feel like, well, I've been on my screen, I've been working the whole day or till say 3 p.m. in the afternoon, and I just have to take a break. That must be normal. And so we just do a lot of re-education that this is what dry eye disease is. These are the signs and symptoms of dry eye disease. And actually, it's not normal. You shouldn't be thinking about your eyes all day long. And so, yeah, just a lot of education at this point. I think it's just more education on the disease state awareness, right? And that this isn't normal. And I would love it if primary care could help us out with this too and just say, oh, you're having this eye issue, go ahead and see your optometrist. They're the expert in eye care and they're the ones that are going to be able to help you. So another really interesting point is that Gen Z gets about 40% of their medical information from social media. And so this is really a gap because they could be getting misinformation from people that are not doctors and don't really understand dry eye disease. And so I think that it's really important as optometrists, as the primary eye care provider, that we are on social media and we do educate them. So they're not getting the misinformation, they're actually getting the correct information. Maintaining that digital presence with having your own, especially if you're in private practice, having your own practice it is, and maybe you have a family, right? So there is a lot of juggling. I love that you said there's AI tools that can help you out. We do utilize AI tools in our practice. They do help us. We actually have a dedicated staff member too. So she's our social media person. She's also my dry eye. I call her my dry eye champion because she's the one that always helps me with like answering patient questions, doing prior authorizations. I literally could not practice without her. So she actually does our social media too. She's very educated in dry eye. And so she can really speak to those things and she can kind of pick out what's important, what to emphasize. I will say one thing that's really very cool and interesting about Gen Z is that they really do prioritize self-care, which is great. So they all have their skincare routines, they have their hair care routine. Hopefully they're brushing their teeth twice a day, right? The dentist did a really good job of kind of drilling that into us. And so they did a great job educating on that. But I would just say add this as part of their routine, as eye care as part of the routine. Get them in the habit of making sure they're doing it every single day. So just like they do their skincare, making sure that they're doing lid hygiene, which is either with a foam cleanser or a wipe, washing off those lids and lashes. One of the biggest things is eye makeup removal. So I always ask my patients, are you removing your eye makeup at night? It's so important that they do that, and they do that every single day. That can really affect the ocular surface. And then things like warm compresses, artificial tears if needed, prescription medications if they're on them. So just making that part of their habit, their routine. So in 10 years, the landscape could look a lot worse for these patients. And this is something that I emphasize in my education in the chair with them, is that dry eye disease, we know it's chronic and it's progressive. So if we don't do anything about it, it is going to get worse. I will give you one tip for those eye care providers out there that have this younger generation of dry eye patients. Make sure you're doing meibography because then you can get actually a baseline of what their meibomian glands look like and watch that as it progresses in the future. And then if it is progressing, we know that there's very little that we can do to change the actual structure of the meibomian gland once it has atrophied. So we want to make sure that we're doing preventative things so that it doesn't get worse. And I do educate them that they're young, right? They have many, many years that they're going to need their eyes to be healthy. So let's take care of it now and prevent that from getting worse. One other interesting thing is that there was some research that showed that there's actually, you were saying, what's the landscape like in 10 years? Well, if we don't do anything funny thing about it, there's actually a decrease in work productivity for dry eye patients. So they're not able to get, say, I use the example of say 3 p.m. because everyone kind of gets tired, their eyes get dry and irritated, in that later afternoon. So sometimes my patients complain, you know what, by 3 p.m., I'm just not able to finish my work. I just can't, I have to get off my screen. I have to give my eyes a break. So they're taking more breaks. They're not getting their work done. Worst case scenario, they're actually taking time off from work. I've had a handful of patients who can't work anymore because their eyes are so dry. And that's really devastating to their quality of life, of course. So this is definitely something that we need to focus on and prevent it before it gets much worse.